Jala Megalia, Lay Shimbentalang, Hagajungrakhe, Yak National Voluntary Blood Donation Day Arhajar Arpaway, Hakaba, Samla Kilawan Shakhmat, but not synñiang like a snam. Yakanika program, Lapnya, the Megalia AIDS Control Society, Lapenlong Hadenbosco Youth Center Shillong. Usampat Kumar IAS Principal, Secretary Health and Family Welfare, Ulalongkum Ukongsan. Daya Danlang ka Alia Project Director Kamegalia AIDS Control Society, Dr. M. Mauri State Tuberculosis Officer, Bat Kiwe. Hagani Kisngi, Lasamro, Yaki Kusnam, Shaki Kenhun, Kibalong Tista, Hakbanot Synñiang, Yakasnam, Balasam, Da Usampat Kumar.
Dr. Eid, Dubai Civil Hospital.
Basically giving a song, presenting a song that is inspiring everybody. So the idea is that how actually we can increase, the quality of life. The quality of life needs to be increased. In fact, there is a concept called, life expectancy. The life expectancy is, it requires, it depends on the quality of, the life that, one actually have. So we really require to improve that one. We really require to increase that life expectancy, productive life expectancy. So that's the aim of, the state that actually through state health policy is trying to promote. So at least can we add another 10 years of productive life expectancy. That's something that, a goal with which we are working collectively. Every week actually all the districts and the deputy commissioners and the district medical and health officers and all the health officials and other social welfare officials, because they have to deal with the nutrition aspects, community and rural development officials, they have to deal with, the issues of poverty. Somebody said, like, our Dr. Mauri from TV, unless we really require to address all the socio-economic determinants of health, so that we'll be able to improve that quality life and also life expectancy of the people of the state. So with this, few words, actually, I would like to again appreciate all of you and also thank all of you for presenting and in this very important campaign. Thank you.